Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you so much for joining us today, Thursday, August 19th, 2021, as we are once again taking your COVID questions live. You'll be able to put your questions directly into the box below. You can also use the hashtag AskDrArwady on either Facebook or Twitter. There's a lot to talk about. There's a lot of questions already coming in. We know you've got questions about boosters. We know you've got questions about masks. But before we get to any of that, I'm thrilled to introduce a special guest today. This is Benjamin Kagan. He is a 15-year-old Chicago resident, a rising sophomore,
yes.
Right? But when he was only 14, he became the founder of Chicago's Vaccine Angels. And we get a lot of questions in here about talking to people about vaccine, connecting people to vaccine. And this is one of our younger Chicagoans who really went above and beyond early on in terms of connecting folks to vaccine. So wanted to bring him on to, again, have a younger person's perspective and really to highlight the amazing work. So welcome so much, Benjamin. Can you let folks know just a little bit, what is Chicago Vaccine Angels? What was this about? And so they know they can put in questions for you.
Sure, I really appreciate your introduction, Dr. Arwady. My name is Benjamin Kagan, like she said, and I founded the Chicago Vaccine Angels back in February. And we are an organization that has helped over 6,000 Chicago residents book their COVID-19 vaccines back when it was, really tough to book. And I, also was the administrator of the Chicago Vaccine Hunters Facebook group, which now has over 85,000 members in it. And we really wanted to help those healthcare workers and those essential workers, get booked for those vaccine appointments when it was so difficult. And then we, started working with some healthcare providers to, start doing mass vaccination events for those people that were struggling so much. And then after all of that work was sort of complete, we moved into helping homebound people acquire vaccines, through the City of Chicago program and through the Cook County Department of Public Health. And then, as all that work winded down, I was able to finally get vaccinated in May when the CDC and the FDA approved the Pfizer vaccine for kids 12 through 15. And then now our work has sort of shifted into more advocacy, reaching out to your friends, talking to people in your community about, why they should get the vaccine and, why it's so important to spread the word so that we can hopefully get to herd immunity so that, I can go to school without having to wear a mask. And unfortunately, we're not at that place right now as the Delta variant continues to surge.
That's right. So can I just tell you how much I love this? So what inspired you at age 14 to say, let's try to solve a problem that all the adults are, having trouble with, where we were working on tech and, there was a lot of demand and, I am proud of the efforts that we made here, but there were a lot of people struggling to get vaccine early on. So what inspired you to do this?
I first helped my grandparents. They live in Florida, and I was watching the news one day and it said, Florida's opening up vaccines to people 65 plus in addition to healthcare workers. And I was like, I got to get on this. I got to help them.
Yeah.
And I got on, their county's website, and it was this super difficult software. And I was like, there's absolutely no idea. There's no chance that my grandparents are going to be able to figure this one out. So I got on there and I started searching, and I started, I tweeted at their county, and then I, eventually figured it out. It took me, I think it was my third attempt on their county's site when they had like a big, big at the time. It was like 500 appointments being released, and there were thousands and thousands of people looking for those slots. And I sort of learned the strategy after going through it the first two times and, not succeeding. Then on the last try, I figured it out that, this is how you do it. And you hit this button and you scroll down and you click. And I eventually was able to, snag 2 appointments for both of my grandparents. And it just really was fantastic for me to be able to help them in that way.
Yeah. And, to your point, most people who are grandparents are a little less adept at a lot of the computer stuff. And I love this connection. So you helped your grandparents, but then what made you say, let's keep going here?
It was a really random thing. I was actually at my school's career week, and it was, Zoom career week. And a reporter came on from CBS Chicago, and he's like, guys, I'm going to be reporting later, like, you should all take a look. So I watched, and I saw a segment about the Chicago Vaccine Hunters Facebook group, which I went on to become one of the administrators of, and then that really sparked my work when I saw so many people were asking for help. And then I originally started posting tips and click here, go to Walmart, enter this zip code.
Yeah.
And then after a lot of that, people would message me and say, even with all the help that you're providing, like all the tips, I'm still struggling to figure this out. So can you just do it for me? And I was like, okay. And it was a little weird at first because it was like, it wasn't as organized as I would think. It was a lot through Facebook Messenger.
Yeah.
And it was like a notes app, and it was like a note in my phone, and it was not really like organized. And then after doing that for a while, I realized that I could standardize the process and create a form, and then it would feed into a spreadsheet, and then I could give that to some volunteers in addition to just doing it all myself. I wanted to be able to scale the operations that I could help more people. So then people would enter their information into our Google form, which would feed into a spreadsheet that was shared with my volunteer team so that we could efficiently book those appointments.
Oh, I totally love this. By the way, you're only 15 now, so you're too young to come work for the Chicago Department of Public Health, but maybe a little later. Operations, scaling, growing, tech. I love it.
We'll see.
We'll see. All right. So I'm guessing you have some more questions for him, because I certainly do. But I know you have a lot of questions about other things too. So as always, let's take a look at some of our Chicago data quickly. I will talk a little bit about the boosters, and then we're going to move right into questions. And we'll do a mix of some things for me and some things for you, and get right into it. So as always, chi.gov/COVID- is where you're going to go. And as you can see here, we continue to see an increase in cases. We're averaging about 456 every day right now in Chicago, and that, as we cross that 400 case threshold per day, that does put us into the higher risk category, as the CDC defines it, as Chicago has defined it all along. And it is in that setting that on Tuesday we announced the return of a mask mandate in indoor public settings in Chicago. We expect that to remain in place while we are over the 400 case per day mark. I'm hoping that won't be too long and that we get a lot of people vaccinated, because that's the most important thing. But it's a combination of vaccination and having everybody wear masks that will help keep this surge, I hope, more similar to what we saw in March, April than anything that we saw prior to the vaccine. You can see we're averaging about 27 hospitalizations per day. That's up just a little bit from last week, but nothing compared to the 200 a day that we were seeing, at the worst of this. We're averaging between 2 and 3 deaths a day. That's continuing to stay really quite low. Those look different, to be very clear, because of vaccine, first and foremost. Our vaccinations are up a little bit. We're averaging about 4,200 vaccinations a day, and I think for you, Benjamin, it was all this work for the 6,000, and I mean it's good to see at this point we're doing 4,200 a day, even when the numbers are lower than they were at the peak. But there's still a ways to go here. We're testing a lot, more than 11,000 people a day, and our positivity is at 4.6%. So I just wanted to also show a little bit more data here. And just put Chicago into some national perspective, because you guys have a lot of questions about that. So this is a map that's showing the cases per 100,000 people over the last week. And you can see that, unfortunately, it's the southeast U.S. Louisiana, Florida, Mississippi are really leading in terms of cases. Nationally, across the whole country, we're averaging about 42 cases per 100,000 people per day. Chicago is currently at 16 cases per 100,000 per day. When we cross that 15 mark, that's when we put the mask mandate back in place. But most of the country really is surging at this point, because more than 95% of cases in Chicago, in the Midwest, and across the country are this Delta, more contagious variant. It's not all about cases, though. It's also about positivity. Nationally, we're currently averaging 9.7% positivity. That's mostly, again, being driven by the South, where you see these dark blue counties are more than 20% positivity. Chicago's currently at 4.6%. I remain very pleased with that. Under 5% keeps us at lower risk, but it is increasing. We'll probably get above 5%. I'm hoping that we don't see major surges again. And then where we look at hospitalization rates, nationally, this is very concentrated. And these stories that you're hearing out of Florida, out of Texas, out of Alabama, Mississippi, Tennessee are very real about hospitals being full, and in many cases more full than they ever were in Chicago on a per capita basis. There's, I believe, 7 states that now have more people per capita hospitalized than they did at any point in the pandemic. and almost all of those people are unvaccinated. Like more than 90%, in a lot of these places more than 95%. Nationally, we're averaging 26 COVID patients hospitalized per 100,000 people, but that's really concentrated in these red areas. In Chicago, we're averaging 9 COVID patients per 100,000, and almost all of ours are unvaccinated. Here's just an individual example from an area with high COVID hospitalizations. This is a hospital in Houston, Texas, and you see here that among 83 people who were hospitalized, this was a week ago, there were 9 people who were vaccinated and there were 74 who were unvaccinated. Generally, where we are seeing vaccinated breakthrough infections get hospitalized, it tends to be people who are older and have underlying conditions, but the great majority are unvaccinated. They had 24 COVID patients in the ICU, all were unvaccinated, 10 on ventilators, all were unvaccinated. And this is the same pattern that we're seeing across the US. Just highlighting, as we're going back to school, there's a lot of interest in what's happening with kids. I encourage you to check out on our dashboard. This is directly off the dashboard. You can see what's happening with child 0 to 17 is in blue here. Rates remain actually lower compared to 18 to 29-year-olds and 30 to 39-year-olds in the light blue at the top here. I expect that those rates will continue to rise along with the rates of the community, but we are in a very, very safe place to be going back to school. Hospitalizations and deaths also remain very low. Here's just our hospitalization numbers across the whole pandemic. We got hit by far the hardest right at the very beginning. And then once a vaccine was available in this sort of February, March, and when Benjamin, when you and your team were working hard to get our most vulnerable folks vaccinated, you see this surge when the Alpha variant came through in May was much lower than what we had seen previously. And although we are having a surge, it is, I remain optimistic that especially for these severe outcomes, if we can just keep getting folks vaccinated, we'll be fine. As a reminder, 99.99% of vaccinated Chicagoans have not been hospitalized with COVID. This is our hospital admission numbers. Again, 0 to 17-year-olds on the bottom in blue, very, very low, so that's been good. And throughout the whole pandemic, really the peak we ever had for child hospitalizations was about 4 per day. You see that matches exactly our worst time period here in the November, December timeframe. And this all along has tracked. We've not seen anything locally here different with Delta at this point. It's just that when communities are seeing very big surges in COVID, we also see that reflected across all age groups. But we're in really good shape for going back to school. We've been sharing these out each week. This is Chicago data, our weekly hospitalization rate by vaccination status. So this red line here shows in March and April, that little surge. Red is people who were unvaccinated, and you see that is the majority of the hospitalizations. The dotted blue was people who were partially vaccinated. As now there's been time for people to get both doses, you see how low that has been. And really, no matter how you look at this, you look at by race, ethnicity, you look at by age, being unvaccinated is by far the biggest risk factor for a severe outcome. So this top graph, for example, shows in purple our non-Hispanic Black Chicagoans who have been being hospitalized by far the most, but it's the unvaccinated Black Chicagoans who are really driving most of that. And then on the bottom right here, the fully vaccinated, you see that risk factor almost goes away. Same thing with age. The gray here is unvaccinated people over 60. So we'll want to hear from you in a minute about the work of especially reaching that group. But I remain very concerned about unvaccinated Chicagoans, especially those over 60, because that is who we are seeing get hospitalized. In comparison, the fully vaccinated on the bottom right, we're seeing almost no hospitalizations. Deaths are the same. 99.998% of vaccinated Chicagoans have not died of COVID subsequently. You can see how well we're doing from a death perspective at this point. And that same pattern where these surges are really coming very heavily on people who are not vaccinated. Here again for deaths, it's people in gray here, unvaccinated Chicagoans who are over 60 is who I am by far the most worried about. All right, so let's turn to your questions. So first, maybe just to start it off again with you. You and your group have done a lot to try to encourage and get barriers down for people who are older. But I'm also interested, as someone who's 15, have you had different kinds of conversations with kids your own age who are thinking about vaccination? How have those conversations maybe felt different?
Yeah, so, very early on, it was one conversation when I was talking to a 75-year-old woman who was, begging me for an appointment, and I would say, let me see what I can do, and I would be able to help. But now, talking to my friends, there's no shortage of supply anymore. I know that's one of the concerns with, these boosters coming up. There's no shortage of supply, so people should not be concerned about getting appointments. So I remember speaking with some of my friends, and I remember, the first dose of my first dose of the Pfizer vaccine. I got it the night it was approved by the CDC and the FDA. I was, all over it. I was like,
and you knew exactly how to fight it.
I was running to get it, and I was like, this place is Pfizer, we're going. Yeah. But, one of the things that people had said was, oh, I get my first dose tonight, and then, in 3 weeks, I'm going to have my second dose, and then we have finals. And that was one of the concerns back in May and June. Yeah. And I said, who cares? Go get your shot. Yeah. Like that was one of the conversations that I had was, it does not matter. Yeah. If you're feeling a little sick for finals, tell your teacher. Like they will be understanding if you're going to get a life-saving, medical procedure. Yeah. And, now as there's, even more increased supply, I've had conversations with people, for example, I went to overnight camp for a month this summer, and I was having conversations with people from all over the world. The camp was very diverse in that there were people from all over the country and all over the world. And I remember speaking with a friend from Spain who I, talked to, and he was like, yeah, the vaccine's good. My parents are vaccinated, but there just isn't supply in Spain. Yeah. And actually, the camp was able to get him vaccinated while he was there, and it was, it was amazing to be able to, get that vaccine. And I've spoken with unvaccinated people, and that's one of the biggest, tough conversations is speaking with unvaccinated teenagers, because in a lot of circumstances, they're just repeating what comes from their parents. Yeah. And that's really frustrating from my perspective. I wish everyone could be vaccinated, and I wish we could go back to having our normal lives back. And that's one of the toughest conversations is talking to someone and saying, well, that fact is wrong. Saying the vaccines don't work, saying there's a microchip in the vaccine, that's just factually incorrect. And those were some of the conversations that I was able to have, and it felt good to be able to dispel that misinformation, because that really does help. At this point in time, the vaccination strategy is going from one person to one person to one person. Yes. And to be able to, talk to that one person that's unvaccinated and convince them, and then, have them go and talk to their friend, it really just, spreads like wildfire. And that, if you can get those vaccinations going by just having those one-on-one conversations, you can really, make a dent in your community's, vaccination rate and really, boost it.
Yeah. Okay. Perfect. Let's talk a little bit about the boosters, because you're right that, I think this is also a piece. People are worried about what's happening with this. How does this fit in? I want to be extremely clear. The most important thing from the perspective of the Chicago Department of Public Health, from the perspective of anybody you talk to in public health, is that people who are not yet vaccinated get that first and or second dose of vaccine. That's going to remain the focus. Those folks are going to keep getting the priority as we move ahead here. And I really want to, just from a logistics standpoint, note that if you've been waiting, and I do think we're going to see the full FDA approval probably very soon. All the safety data is done. I'm hoping maybe even by Labor Day, if not probably September. I also want to note that there are going to be a lot of people probably rushing to want to get a booster again, similar to how it was at the beginning when you were helping. And I don't want to crowd out those folks who haven't yet gotten the first dose. So please, it's going to be at least a month, probably a little more, before we actually start to have booster shots available for anybody who is not immunocompromised. And so please take this next month, if you're not vaccinated, to get it, because I don't want people in this whole scramble. I want folks kind of having the opportunity now. So we're getting a number of questions, a lot of details about just, what is happening with these boosters, what do I need to know? So Belinda Jackson on Facebook, for example, says, I had my Pfizer vaccines, January 2021. Well, I need a booster shot. I get a yearly flu shot. When will I know when to get a booster? Jessica is writing in, have we started trials and tests for the booster shot so the public will know what the side effects are? Juan Rangel is asking, are boosters the same as the vaccine or is it a different makeup? So let's just talk really quick about top line on boosters. So just yesterday, I believe, there was a statement from the head of the CDC, the head of the FDA, Dr. Fauci, the NIH, a lot of the governmental leaders really saying, we're announcing that after looking at some data suggesting that these vaccines remain unbelievably protective for hospitalization and death. That's the most important thing. But they are seeing some more breakthrough infections, particularly in places around the country that have been hit harder than Chicago, more with the Delta variant. There's some thought that with the Delta variant, because it is so much more contagious, you don't need as much exposure to the virus to potentially become infected. And so one of the reasons the CDC changed the recommendation around masking indoors for places that were at high risk, like Chicago is that although the risk is so much higher for unvaccinated people, it has never been nothing for vaccinated people, and it is a little higher than it was when those rates are up. And recognizing that there are folks who still are enjoying very good protection. So for example, we'll post links to these, but there was some data from New York that showed in the real world, the Pfizer and Moderna vaccines were in the 92% protection range when you're looking back in around May. And if you look in July, they're in the 80% protection range, which is still a very protective vaccine. And the protection for hospitalization remains, well over 90%. But still, that's enough of a concern that I think they were looking at this and said, chances look like we probably are going to want to offer booster doses, especially for more vulnerable people. So we've already started with immunocompromised. Right now, you can only get a third dose of Moderna or Pfizer if you have a severe immunocompromising condition. That's current cancer or very recent cancer treatment, and you're immunosuppressed. That's a stem cell transplant or an organ transplant recently. That's untreated HIV. Or a primary immunodeficiency. And if you have one of those conditions and you got Moderna or Pfizer and it's been 28 days since that second dose, you should seek a third dose, but we want you to talk to the specialist that you see for that immune condition because there's timing implications here. You should get that dose timed around when you take your immunosuppressant medications. So this is not for anybody who has diabetes or has, other things that can affect the immune system. It's really for folks who have these more severe immune deficiencies. So please talk to your doctor about that, and then we'll make sure we can get you vaccinated. For everybody else, just like always, the FDA and the CDC, through the Advisory Committee on Immunization Practices, needs to weigh in on this data. And to the question about have there been studies, yes, there have been lots of studies. And just earlier this week, actually, Pfizer, for example, submitted its safety and efficacy data around those booster doses. That has not yet been submitted for J&J. That's why you're not hearing anything about J&J just yet. But J&J only became available in the U.S. in March. So it'll be a few more weeks before we start to see some of that data come in. So absolutely, the FDA will be looking at this as it is shared. We'll also be able to share with all of you what were we seeing about side effects, what are these recommendations, et cetera. And then we'll be starting with the most vulnerable people, the nursing homes, for example, where the CDC yesterday shared a nationwide study, again, seeing some drop some drop in vaccine efficacy, although it's still quite protective in that most vulnerable setting. And the last thing we want is problems in the nursing home. So I was really excited yesterday. There was a lot around the boosters, but I was actually even more excited to see this announcement that the federal government is going to require across the whole country any nursing home that wants Medicare or Medicaid reimbursement to require its staff to get vaccinated. I am thrilled about that. The Chicago Department of Public Health does not regulate nursing homes here in Chicago. It's not something we can easily do, but it is almost impossible, I would say, to run a nursing home or a long-term care facility without accepting Medicare or Medicaid, because Medicare in particular is how people over 65 are insured for the most part in this country. So I think that's really helpful, and we're thinking a lot about protecting that most vulnerable group. But I think for all of you, we need to see the recommendation formally from the FDA and from the CDC. None of this is going to happen in the next month or so. They're saying the earliest would be September 20th, but it's not that like if you got vaccinated on January 20th, right away you're going to get it. There will be much more coming out. We'll share operationally with you what this is, but please rest assured that if you are already vaccinated, you've done the most important thing in terms of protecting yourself. These masks that we have on right now while we get through the Delta surge help, and they help also with the potential for breakthrough infections. And I was an early person to get vaccinated. I am sitting here very comfortable in my vaccinated status, and we will share more about this. Okay. We've got some nice comments for you, Benjamin, do you realize what an inspiration you are? Thanks for helping your grandparents get vaccinated and going on to help so many others. So thank you for that. Can you talk about your experience getting vaccinated? Did you have side effects? What are you hearing from kids, and how do you recommend people talk about this?
Sure. Excuse me. Sure. So I got vaccinated, like I mentioned. I got it the very first day that it was available for my age group. And one of the concerns for people my age is, how are these side effects going to hit me? Right now I'm playing soccer every day. I'm going to preseason soccer. That's where I was this morning before I came over here. And one of the concerns is, am I going to get vaccinated and then am I going to be knocked out for 2 days? And am I going to miss school? And am I going to have to make up homework assignments? And am I going to be falling behind? Because the Illinois State Board of Education has said that everyone has to be in person. People don't want to fall behind, and that is a valid concern. And I feel that I would say, get your vaccine on a Friday night. Go get your vaccine on a Friday night. You have Saturday, Sunday to recover. Do that. It is so incredibly crucial for kids my age and everyone 12 through 17 to get vaccinated, because that is a key demographic before we all return to high schools, and that demographic above 17, people that are going into colleges and they're going to be in those congregate living settings like dorms, they need to get vaccinated as well. And I understand the concerns about side effects. I personally had probably worse side effects after my first shot. I was tired, and that was probably because I tried to go to bed at 2 in the morning and then be up for school at 7:30 the next day, and well, that really didn't work out. But it did. It was not that bad. Truly, I was tired. I was a little fatigued, but I got up and I got going. And then my second dose, honestly, my arm hurt a little bit, and that was all.
Okay, very good. And more than half of Chicagoans aged 12 to 17 have now gotten that first dose at least. Yep. We're at about 54%. It is the fastest growing group in Chicago, which we've been really pleased to see as we head back. All of our other age groups are over at least 60% vaccinated. And so, I agree with you. There's work to do certainly among younger folks, and we'll be working with schools to encourage that. Chicago Public Schools, in case you're not aware, for example, has mandated vaccination for all of its adult staff, but also for any kids who want to do athletics. They've said any kid who wants to, participate on a sports team either needs to be vaccinated or is mandated to do the testing, and they're pushing very hard for vaccination. So, there's going to be a lot of this sort of coming, and, like everything, the more vaccinated any setting is, the lower everybody's risk is for COVID. All right, let's get through some more of these here. Question, Krista from Twitter. My Chicago teens were vaccinated in April in Indiana before shots were widely available in Chicago. How would the city know? I want to make sure they're counted. Their CPS school had not yet asked about vaccination status at registration. Okay, so we have been talking a lot to Indiana, knowing that there were fewer Indiana residents really anxious to get vaccine than there were Chicago residents, and Indiana was great. They really opened up their mass vaccination sites. In Gary said, come one, come all, and we did have a lot of Chicago residents. So there is some work happening behind the scenes to make sure that different state registries can talk to each other. We've shared some data so that we know kind of what those numbers look like, et cetera. But rest assured that, where you are registered, and the goal is also just to have this all be connected across the entire country, right? This is some of the work of really modernizing a lot of the way we, to the original point, like the tech of public health, right? The tech of healthcare. It's not designed to be particularly interoperable, and there have been a lot of things that were put together fairly quickly, and we've got to invest in this in a long-term kind of way. So, if you've got your kid's vaccine card, you're good. You can always get copies of that if if you got vaccinated here in Illinois or in Chicago, you can download from the state registry. There's also an email address that you can send. You can contact Indiana if you needed to in case you lost it. But rest assured, you're covered, and there absolutely will be opportunities. I'm a little surprised, actually, you didn't already share your vaccination status with CPS, but there will be, it's depending a little bit what's happening with the school. There's work happening to document vaccination status and then also offer opportunities for parents, for example, to agree to vaccination for their kids and then have some of that available. And different schools are doing different things here. Yeah, the email, if you are here and your email was, your vaccination was here in Illinois, you can email covid19vaccine@cityofchicago.org. We'll help you get a copy in case you lost your vaccine card.
Yeah, and I would mention that at a lot of the retail pharmacies, they do have their own proof of vaccination status set up. I know that if you were vaccinated through Cook County the way I was, they also have their own proof set up. And I know Walmart, CVS, and Walgreens all have their own. So take a look if you were vaccinated at a retail pharmacy and look into that software and see if you can get one through them as well.
Absolutely. And your provider also. Anywhere where you got vaccinated, they have your record. They can give it to you again. That email address is to help people who are having trouble or for whatever reason. When you get vaccinated at a Walmart or what, it also does then go into the state registry. Yeah, thank you for getting your kids vaccinated. All right. So a couple questions here. Jim Caps on Facebook. Why are vaccinated people still getting COVID? So the vaccine has never been there is no such thing as a 100% protective vaccine. I wish there were. But in the original studies, these vaccines were over 90% protective, which is amazing for a vaccine. Even where we've seen some of these breakthrough infections again, remember that especially the protection against hospitalization and death remains excellent, even in these places that are surging. And I would say that the reason vaccinated people are still getting COVID is that COVID is still very much here. And so people are getting exposed to COVID, and that vaccine is doing the bulk of the work to protect you, right?
Yeah.
But there are, especially when we're at higher risk, there are more people here in Chicago who have COVID. And so putting that mask back on in an indoor setting, especially if it's a public setting and you don't know if everybody's vaccinated, adds another layer of protection. Doing things outside adds another layer of protection. We don't have anything, a mask, a vaccine, a treatment. We don't have anything that 100% stops COVID. We're not going to eradicate COVID. But getting vaccinated and then doing these other mitigation measures when we're surging is part of that. Do you want to add anything to that around, this is a question we get a lot. Why are folks who are vaccinated still getting COVID?
Obviously I'm not a doctor. I don't have a medical degree. Honestly, I'm 15. I'm going to be a sophomore in a few weeks. I don't even have a high school diploma at this point. But I will say, I'll repeat something that my biology teacher told me over this past year. Nothing is ever 100% certain. You never know something is fully going to happen, and like you said before, there is nothing that is 100% going to eradicate this disease. But we just have to use the tools that we have right now, and that tool, our best tool, is being vaccinated. Getting tested is fantastic. It's great to know what you are at, what your infection status is at the very point where someone, swabs your nose. But, really the most important thing is going and getting vaccinated, because that is just the best way to eradicate this disease and, get our country and our city and our state to herd immunity.
Love it. All right, good. So there's a number of questions here. just about, people who continue to, I think, have some doubts. I'm actually going to read you a quick excerpt. There was an article in the Los Angeles Times today, yesterday. There was an op-ed actually from a healthcare provider, right? I'm a doctor, so I have a lot of friends who are doctors. My Facebook feed is full of people who are doctors who are really tired, right? Not just the health department, but people who have been working for 17 months taking care of patients with COVID. There's this worry about what we call compassion fatigue, where people who are very caring, who want to take care of folks, are just feeling frustrated when they're seeing patient after patient after patient who is unvaccinated, coming in, and how they think about that. And I'm just going to read a couple of points from that. She tells the story of an individual patient who she cared for who had not gotten vaccinated because he was concerned the FDA had not yet given full approval to the vaccine. And yet he had actually decided to trial a lot of things like antibiotics and hydroxychloroquine and some other things that are not FDA approved, and in fact have FDA recommendations against them. And she talks a little bit about why some of that was, and when he comes into the hospital, she has a conversation with him about the best treatment available, which is remdesivir, has a lot less safety data behind it than vaccine does. And does he still want to get it? And unfortunately, he does pass in this article. But she's sort of talking about how the team is trying to deal with that a little bit. And there's just a series. We'll post the link, but these are some of what I get comments about, emails about every day. And I'm just going to read some of her words because I think it's good. She's talking again just that the worry is for the unvaccinated, those who are eligible but are choosing not to. There's a decision, she says, a decision they defend by declaring vaccination is a deeply personal choice, but perhaps never in history has anyone's personal choice impacted the world as a whole as it does right now, when hundreds and thousands of people continue to die, when the most vulnerable members of society, our children, cannot yet be vaccinated. The luxury of choice ceases to exist. She says, and these are things she says to patients, if you believe the pandemic is almost over and you can ride it out without getting vaccinated, you could not be more wrong. This virus will find you. I agree with that. You're going, at this point, one way or another, you're either going to get a vaccine and have protection from COVID in the safest way possible, or you're going to take your chances with COVID disease. That's just what we're seeing. She says, if you believe I'll just wait until the FDA approves the vaccine first, you may not live to see the day. The good news is I think the FDA approval is coming soon, but all of that safety data is really good. There have been more than 4.5 billion COVID vaccines given around the world, more than 350 million in the US, more than 3 million here in Chicago. No long-term safety concerns. And if you're waiting for that piece of paper, it's not going to be too much longer. Please be, if you still are really feeling that that's going to be your decision, as soon as that comes through, please promise that you're going to go and get it done fast, because I don't want you competing with everybody then looking for boosters. And be extra careful, wear those masks, be outside, distance, don't go near vulnerable people in the meantime. If you believe if I get infected, I'll just go to the hospital and get treated. She says there is no guarantee we can save your life, nor even a promise we'll have a bed for you. And this is one of my biggest worries. When we're making these decisions at the city level, the reason we put a mask mandate in place is to try to keep our city open, but also be careful, because we cannot let our health system get overwhelmed. I have seen what that looks like. When I worked, for example, in Liberia on the Ebola outbreak, I saw the entire health system shut down. I saw, healthcare workers get infected and die, but then I saw people not be able to go to the doctor or the hospital after a car accident, to deliver a baby, to get their medications. Many, many more people ended up dying of other things than from Ebola, and we can't risk that. And so, our goal is not to have to do more aggressive things in terms of shutting things down, but we will do it if we are getting into a situation again that threatens the healthcare system. We're not there at all right now, I'm pleased to say, but getting more folks vaccinated vaccinated helps us do this. And so she goes on like this. I'll let you lead, sort of read the rest. The last one maybe, because this is relevant to a lot of questions. If you believe vaccinated people are getting infected anyway, so what's the point? The vaccine was built primarily to prevent hospitalizations and deaths from severe illness. And I'll just add as an aside, it's the same thing like an influenza vaccine. Our flu vaccines are not 100% protective against flu, but they really limit how sick people get, and they especially help keep people out of the hospital, and they help keep people from dying. And the COVID vaccine, and the most important thing is there. So she says, instead of fatal pneumonia, those I see with breakthrough infections generally have a short, bad cold. So the vaccine has already proved itself. The vaccinated are not dying from COVID-19. And you know, it sort of goes on from there. So Anita Sarkar is the author. She's an infectious disease physician at the UCLA School of Medicine, and we'll put the link in the quote. In the link. But you know, I know that a lot of people are really worked up about COVID right now. I've gotten a lot of people who are upset. They say, I'm already vaccinated. Why are you telling me I have to put a mask back on? I've got a lot of people writing me who say, I'm never getting vaccinated. You better not ever make me, and this is my choice. I've got, on both sides, this has become increasingly politicized, and I would just encourage everybody to try to think about what is your goal. You know, what is your, I talk about this for school. Like, my goal is to make sure that kids are safe and that kids can go back to in-person learning, because we know that is important. You look at the risk benefit there, and it's been very clear for a long time to me where that lives. But where you think about kind of the goals from COVID, I don't want more Chicagoans to get hospitalized and die. Like, it really is as simple as that. And I don't want to overwhelm, you know, at the larger level, I don't want to run the risk of overwhelming our health system or having to, you know, potentially take big steps backwards that put people out of work again, or that keep us from, you know, as you said, being able to go back to our lives. So there are a lot of people in Chicago who are still getting vaccinated. You know, like I said, we're doing about 4,000 a day every day, and it is people in some of the least vaccinated neighborhoods that are getting vaccinated the most, who have the most barriers. And so I remain, you know, optimistic that we're making progress, but it is, I can just see the surge coming, and every day we're getting these reports in of unvaccinated hospitalized people, and it just, you know, makes me sad a little bit at some level.
Yeah, and if I may circle back on schools, you know, one of the most difficult things for people my age was doing that online learning, because, you know, along with online learning, you know, I just was not seeing, you know, wasn't seeing my friends as much.
Yeah.
And that was really difficult for me. You know,
Yeah.
I could go and book 200 vaccines in one night, and I would still be, you know, sitting in my bedroom at my desk, you know, that I haven't left all day, sitting in my pajamas.
Yeah.
And it was frustrating. And, you know, from an adult's perspective, you may be working, you may be doing your job as an essential worker, but, you know, bringing those kids away from that in-person learning, which is so important to your social, emotional welfare, is just so difficult, and it's frustrating from my perspective as a student, and I can promise you it's frustrating to other people my age that did their part, that got vaccinated, that, you know, got tested, that wore their masks, and, you know, now we did our part, and now we need you to do yours. You know, if you're unvaccinated, please go get your shot. It is very much available. You can go to vaccines.gov and you can enter your zip code, and, you know, a website will tell you exactly where you can go. And, you know, it's you know, the last year of school was just horrible, and it was just not enjoyable, and I felt like I learned less. And
when were you were remote part of the year? Actually, I mean, there's lots of questions about schools too, so let's talk about that a second.
Sure. So I was remote fully until February of 2021, and then in February of 2021 we went in person for 2 half days every 2 weeks, and then in March it morphed to 2 half days every week, and then eventually in April we finally were able to move to fully in person, and that was just fantastic to be able to go back and to be able to, you know, in a safe manner, in a manner where we've got incredibly protective air filters and masks, and you know, a lot of our teachers are vaccinated. You know, it felt great to be able to be in that safe setting, you know, with that 3 feet distance recommended by the CDC, to be able to sit there and have a conversation with a friend that I hadn't seen for, you know, a year, where, you know, I can stare at them in a little box on Zoom, but it just is not the same thing as being able to have a conversation and just really, talk and, build up those relationships.
Yeah, I agree. And there's a comment here, from someone on Twitter, which is a greater danger to kids and their families, staying home and learning remotely or getting COVID? Serious question. And I would say that is a false question, because I am very confident that we can have in-person school. And it is essential for kids of all ages to be with other kids. This is part of our development, and that's true for young children, that's true for adolescents. And it is critical that we set up our school environments to be as safe as they can be. And I'm really pleased with all the schools in Chicago and what they're doing to do that. But it is also essential. COVID is not going away, to be really clear, unless we have some new breakthrough, that we do everything we can to support essential things like going to school in person and ensuring kids, get their biology lessons, but also, have those social, emotional, and just the interactions that are needed and that are important for mental health and important for development. Thanks for chiming in on that. Robin McCarthy on Twitter is saying, for those of us who are vaccinated, if we become COVID positive, are we as contagious as non-vaccinated COVID positive people? Good question. This is one of the things that there has been increasingly more evidence about. Prior to Delta, we were able to say definitively, if you had a breakthrough case and you're vaccinated, you are much, much less infectious. There have been a couple of more studies, again, with Delta in places where COVID is surging or there's big outbreaks, where, for example, they've seen in people who are fully vaccinated, they're able to carry very high levels of COVID in their nose, similar to how someone who is unvaccinated is not. That said, people who are unvaccinated, they don't carry this anywhere near as long. They're much less likely to, have the symptoms, have the issues. And so there certainly is, I would say, decreased risk. So it's not that you are as contagious as non-vaccinated COVID positive people, but you are still have the potential to be somewhat contagious. And so that's, again, part of the reason for the mask at this point. And thank you for just saying the thing about, I know it can be frustrating when you've done all the right things. And I know, so especially those of you, frankly, who tune into, Facebook Lives a year and a half into this, I know a lot of you are absolutely have been doing the right thing all along. And I know it's hard to feel like things are going backwards. But please know that these masks, they're not forever. They're to get us through Delta. And they do help protect everybody. Even those who are vaccinated right now. But if you're fully vaccinated, I'm not worried at all for my own personal health in terms of what's coming. But I am continuing to wear a mask indoors. Nancy Whitting via email. Can someone have a second or even third breakthrough case? I've not heard anyone talk about this, though maybe it's never happened. So I never say never for anything with COVID, right? But what I'll say is that it's relatively new that we're seeing these breakthrough cases. They remain rare. And some of the very best evidence I've seen is that when people actually have had both a natural infection from COVID and a vaccination against COVID, they actually have fantastic levels of protection. It's probably the very best, right? If you had to choose someone, and in most cases, this is someone who had COVID, a year ago and then was vaccinated. That's probably the best level of protection. Next is someone who is fully vaccinated, and then quite a bit lower is someone who's only had a natural infection without having had the vaccine. So I would say, I think it is unlikely that someone would have a second or a third breakthrough case. They're unlikely to even have the first. And if they did, they are probably getting some additional, from the immunity from that natural. But the other thing is maybe they're immunocompromised and don't know it, right? Maybe that vaccine has not taken in the same way, and so maybe they don't have the full level of protection, for example, in which case they could remain vulnerable to COVID. So it probably has happened, it probably will, but it is not, at this point, I've seen nothing in the data that would suggest it's common or a concern. Good question.
And another thing that I've heard from people my age is that, I tested positive.
Yes.
A few months ago, now I'm safe and I'm protected. That is factually, not true. Doctor, you can back me up on this. If you have tested positive in the past, you still need to go get vaccinated to really boost that immunity. I mean, I'm sure you can back it up with more science.
And particularly as the Delta variant has emerged, et cetera, we've been following, not breakthrough in terms of vaccine, but people who have gotten infected again, and the getting the vaccine, it remains very important. You certainly have some level of protection if you've recovered. It's better than nothing, but for the level of protection that you really want, particularly with Delta, you absolutely should add a vaccine to that. We'll run through a couple more just real quickly here near the end. Rita Guerra from Facebook. Where can you go to get checked to see if you have COVID, no insurance? Please go to chi.gov/COVID test, assuming that you, or chicago.gov/COVID test, assuming that you live here in Chicago. There are multiple settings where you can get a COVID test free. There is a fund that is set up to ensure that people who are uninsured are still able to get tested. I would not encourage you to just walk into an emergency department, for example, where you're likely to get hit with fees about being in the emergency department, even if not for the COVID test. So do check that out. And you can also buy over-the-counter COVID tests, antigen tests, which I recommend. They're 2 for about $24, so they're not completely free, but if that is within reach for you, that is one easy way to get it. But otherwise, there are plenty of places, but ask the question first so that you don't end up getting a bill.
Yeah, and I know IDPH also has those mobile immunization sites set up, and I believe that Cook County is conducting tests at Stroger and Provident hospitals as well.
Yeah, there's lots of places, but it's a good thing to be aware of. So definitely take a look. Okay. Beth Delaney on email says, why is there a mask mandate but not a vaccine mandate? Where's the reward for people who've made the right decision to get vaccinated? She says, I encourage you to reconsider the mask mandate and instead implement a vaccine mandate. So, thank you for that. I hear your frustration in there in terms of being someone who presumably has done those things. What I'll say is that we know masks work. We know that they add protection with vaccine. We know there are a lot of unvaccinated Chicagoans. I've been thrilled to see so many settings in Chicago requiring vaccine or a negative test. Businesses, there's an association of 60+ theaters that have said this. Obviously, we've been promoting it and making sure it's part of kind of larger events that are happening. Restaurants, bars, clubs, higher risk settings. But what I will tell you, if I have learned nothing, is that when people get more politicized around an issue, it usually doesn't help a whole lot. And so I'm very interested to see what happens in New York and San Francisco, where they've gone a little bit farther as a city in terms of some of these requirements. I can tell you when I look at France, which was one of the first countries to really do a vaccine mandate, we saw an initial uptick in vaccines. They said you have to get vaccinated to go into a restaurant, a cafe, et cetera. But then that did not really hold, and we saw big protests, and actually a lot of people getting much more vocal against vaccine, feeling that it was cutting back on their ability to do things. I also think it depends on where we are in terms of our COVID risk. New Orleans, which is not a city that you might associate with a lot of aggressive sort of maybe government moves, is being hit so hard that they are doing much more, and businesses are actually asking for it and setting their own requirements around vaccination. But I want a setting to choose to ideally mandate vaccine because they recognize it's what keeps their workers safe, it's what keeps people who come in safe. And having a mandate of people who don't believe in vaccine aren't going to enforce it and might get more politicized is some of what we're thinking about. But we're going to follow this. If we see it be really successful in other settings, we may consider it down the line. But I've been really pleased to see so many settings doing this independently because then they own it more too. And schools and universities and healthcare and some of the highest risk settings is where it's particularly important. Anything else you want to add to that?
No, I think you covered it all. Eventually, my hope is that it's mandated, immunization when you walk into a school building. Mm-hmm. I know that CPS has said, if you're an adult and you're walking into a school building, you must be vaccinated. And I know that they laid out that requirement for staff. But my hope is that with the potential approval of the Pfizer vaccine coming up for children 5 through 11, mm-hmm. That can be added as one of those childhood immunizations that you need to initially enroll in a school the same way you have with all those other shots that we get as children.
Yeah, and yeah, we'll see where this goes. I think obviously we have a long history of recognizing schools are a setting we want to have a higher safety standard and make sure we're doing everything we can to protect. So to be clear, there is not a requirement at this point for children to return to school, and we want everybody going back to school. But as more people have that opportunity, as you said, as we see the vaccines get that full approval for younger children, et cetera, this may be something next year, for example, that we're looking at. Okay, we are just about at time here. Namrata Batra is asking about mask types in class sizes for unvaccinated kids in elementary school. I'll just say that the most important thing is that your child is actually wearing a mask and that it fits well. So there are lots of different kinds. If you go on any of the Wirecutter or anywhere else, you can see some very specific recommendations around mask type. You can get some of these, if you want to get a KN95 or an N95, you are absolutely welcome to do that. They have a higher level of filtration, therefore a little bit higher level of protection. That said, sometimes children don't find them as comfortable, and the fit has to be good. A mask that a child is comfortable with and can wear is the most important, and that fits well. And so there are some tricks. For example, when it's hot out, the blue surgical masks I really like, but for kids in particular, there's a way that you can loop the bands if it's larger for them that help make that fit a little bit better. The most important thing is that everybody's doing it, right? Because the main thing the mask is doing, it's source control. It's helping keep my germs with me. Secondarily, it is also providing some protection from germs out in the world. But that's why the universal masking, particularly in settings where not everybody is vaccinated, that is the most important thing that lowers the risk for everybody. So it's really the mask that your child feels comfortable with. We had a pediatrician on last week talking about this in some more detail, and we'll post some about this, like on CDPH's social media. I'll post a link to a video about how you can size things and how you can look at the ear loops and think about this. There are cloth masks that you can insert filters in. There's all kinds of different types, but the most important is that the kids are wearing masks, and we've absolutely seen the young ones be able to do that, whether that's the expectation. And we'll also post a link to there's a data page with about 60 studies about masks and their efficacy, how well they work. We still continue to get questions of people thinking that it hurts oxygen or carbon dioxide levels. So we'll post a link there where you can read the original studies if you want to actually see what we know about masks. They clearly are an important part, especially in settings where vaccines are not widely used yet. And they're going to be a part of our strategy as we continue to sort of see these peaks. That's what I have to say about that. All right. So thank you so much to everybody. Thank you especially Benjamin Kagan, rising sophomore at Francis W. Parker School. So congrats to the biology teacher who is teaching you well there. But really especially, for your work, as amazing to see a 14-year-old decide to say, I'm gonna solve a problem here, and I'm gonna solve a problem that isn't. You couldn't even get the vaccine at that point. And thank you for, you and everyone who really helped people access that vaccine. And I just love Chicagoans who do this, right? Who you weren't getting paid to do this. This was something you did for your grandparents, and then you said, let me just help 6,000 other people do this. And, and then have continued to think about how to message, because I love it where we have young people connect with older folks, and any young people watching this, if you know somebody, especially over 60 or 65, please reach out. Can you help them get vaccinated? At this point, they don't need to use the internet, right? You can call 312-746-4835. Anybody in Chicago will bring it to your house even. There are still a lot of barriers, and people still, in a lot of cases, are meaning to get vaccinated but haven't yet. Yeah. And I think, and then talking with people your own age, because I'll be honest, teenagers listen to teenagers more than they listen to people like me, realistically. So thank you again so much for everything that you and your organization have done, and I want to give you the last word if there's anything else you want to say.
No, I mean, I really appreciate you having me on today, Dr. Arwady. I would mention, you go to get groceries, you go to a Jewel Osco, they have vaccines for walk-in. You go to Walgreens to pick up your prescription, they have vaccines for walk-ins. You go to CVS for your prescriptions, go there, get vaccinated. I guess my last word would be just please go get your shot. It will help everyone in your community, and I really appreciate you having me on today, Doctor.
Yeah, thank you so much, Benjamin. Couldn't say it any better than that right there. So thanks again for being on. I will not be on next week because I am taking a vacation. I am not going to Ireland like I was originally going to a year ago when it got scheduled because it's a level 4 CDC advisory. But I will be in Southwest Michigan for a few days, which is not exactly the same thing, but will be lovely. Trying to take a little bit of a break. But I wish you the best of luck in school.
Thank you.
And the best of luck to really all of Chicago's young people as we return to school. I know parents have questions. Please keep sending them in, but know that we right now are in a much better place from COVID than most of the rest of the state and definitely most of the rest of the country. Where we can get folks vaccinated, it just keeps making that position even better. So thanks again, and we will come back not next week, but the week after to take more of your questions. By then, we'll probably know more of these details about boosters as well. In the meantime, be well. Thanks again. We'll see you in a week.